Hello and welcome to Lyra Nara. In today's video, we're going to talk about a very little known subject, and that is methylene blue and the amazing health benefits that it can bring you. And if subjects like this interest you, where we talk about natural holistic health solutions, please like, share and subscribe, and don't forget to hit the notifications button so you don't miss out on the videos that we put out every week. And with all that being said, let's dive right in and learn more about methylene blue and what it can do for you. So let's kick this off by talking about a history of methylene blue, how it was discovered and what it is. Methylene blue was discovered in Germany in the late 1860s and was used as a textile dye. And thereafter it was successfully used to treat malaria in humans. In the early 20th century, psychiatrists used methylene blue in schizophrenia therapy, and today it is studied and used as a remedy for cognitive impairment, neurodegenerative diseases such as Alzheimer's and Parkinson's, memory enhancer, as an anti-aging agent, and as an energy enhancer. And all of these conditions share a very common problem that is related to the mitochondrial function, or to be more precise, a mitochondrial dysfunction. Your brain's neurons, they rely almost entirely on this mitochondria-derived energy, and a failure, therefore, of this mitochondrial function can affect the rest of your body, and it's particularly detrimental for your brain. And this is where methylene blue steps in as one of the most important anti-aging and neurological disease-preventing nootropics that we have available today. As a nootropic, methylene blue quickly crosses the blood-brain barrier. It improves mitochondrial efficiency and respiration. It also acts as an antioxidant and increases brain cell lifespan, resulting in improved memory and mood. Methylene blue has also since been used to treat dementia, malaria, methemoglobinemia, urinary tract infections, cyanide and carbon monoxide poisoning, and many more conditions. Next, let's look at all of the changes that happen within our bodies as we live and age. Because as we live and as we age, our brain chemistry and our metabolism, they both change. Meaning that the mitochondrial energy levels decline, our attention, memory and mental agility, they decline as well. The tau proteins and amyloid plaques clog up the brain. Free radicals, they start damaging the brain cell mitochondria, and also the cerebral blood flow declines. And all of these changes can happen at any age and are a product of the food we eat, of what we drink, lifestyle habits, the air we breathe, the stress that we are exposed to, and epigenetic factors. And methylene blue can help stop and even reverse age-related cognitive decline such as this. A student, for example, looking to do better in a school exam can be helped by simply boosting brain cell mitochondria energy levels and improving cerebral blood flow. Low-dose methylene blue supplementation provides memory-enhancing effects in animals and humans. It works as an antidepressant also, and it is also an exceptional anti-aging remedy. It helps stop dementia, Huntington's, and Alzheimer's disease. Methylene blue increases low blood pressure, it improves cognition in healthy people, it boosts mitochondrial function, it is also antimicrobial and can eliminate fear and even slow down skin aging. And methylene blue is a very interesting substance because it can act as a neurotransmitter, it can act as a mitochondrial energy booster, and also as a neuroprotectant. As a neurotransmitter, methylene blue inhibits monoamine oxidase and acetylcholinesterase activity, increasing thereby the levels of acetylcholine and catecholamines, and it boosts serotonin as well as norepinephrine. As a mitochondrial energy booster, it assists the brain cell respiration by increasing oxygen. It donates electrons to the electron transport chain within the mitochondria, and therefore it provides this fuel without you having to eat. It increases cellular energy, positively affects your mood, your memory, and your cognition. And as a neuroprotectant, methylene blue acts as a neuroprotectant because it is a very potent antioxidant. So reactive oxygen species are produced inside of the mitochondria, as you might know, and the first free radical that is formed inside a cell is called superoxide. And methylene blue will bind to superoxide and reduce it to water. It stops thereby the oxidative cascade at its very beginning before it gets a chance to do damage. Let's look now at the health benefits that methylene blue offers you. Methylene blue, as we've already touched upon, boosts brain health and function in several ways, but two in particular stand out. First, methylene blue improves memory. But it does not do this like other neurotropics, where other neurotropics often work by increasing neurotransmitter synthesis and neural signaling. Methylene blue, on the other hand, improves memory by increasing brain cell respiration and how the brain cells utilize oxygen. It accepts electrons from NADH and transfers them to the cytochrome, and methylene blue also stimulates glucose metabolism. Therefore, taken together, NADH and methylene blue, they increase CMR2 and glucose uptake, and this translates to methylene blue elevating oxygen consumption, which helps glucose increase ATP production, and that means, of course, available energy to your cells. And by increasing ATP production, methylene blue provides more cellular energy, of course, for better overall brain function, including cognition, mood, and memory. Secondly, methylene blue is a very potent antioxidant. It has a unique mechanism of action that is fundamentally different from traditional antioxidants. During cellular respiration, the first free radical formed inside a cell is called superoxide. Methylene blue binds to superoxide and reduces it to water. It stops the oxidative cascade at its very beginning before it gets a chance to do damage. And so think of methylene blue as having a unique dual property. First, it increases cellular energy production, which normally leads to oxidative stress. And secondly, it eliminates this oxidative stress, behaving as a metabolic enhancer and as an antioxidant. Methylene blue can also rescue brain cell mitochondria from the damaging effects of toxins. For example, the toxins responsible for Parkinson's and Alzheimer's disease. It does this by donating electrons in the electron transport chain broken by those toxins, essentially bypassing the broken transport chain with donated electrons as an alternative electron carrier. Methylene blue also counters cerebral ischemia reperfusion damages. So those are the tissue damages that are caused when the blood supply returns to tissue after a lack of oxygen, as can occur, for example, with a traumatic brain injury. MB accomplishes this by rerouting mitochondrial electron transfer, and this means that methylene blue dramatically counters the behavioral, neurochemical, and neuropathological impairment found in Parkinson's and Alzheimer's disease patients. But those are not all of the health benefits that methylene blue can provide you with. There is more. It can also boost acetylcholine. It's an acetylcholinesterase inhibitor with a preference for the so-called muscarinic acetylcholine receptors, and makes therefore acetylcholine more available to your brain. It's also a great antidepressant. It's a so-called monoamine oxidase inhibitor, or MAOI for short. It inhibits the monoamine oxidase A more than the B type, but both at large doses. One study, for example, in 1987 showed that 15 milligrams per day of methylene blue was a potent antidepressant in those with severe depression. Another study with 31 bipolar disorder patients compared 300 milligrams per day of methylene blue with 15 milligrams per day, and the patients were also on lithium treatment in this study. And the study showed that the 300 milligrams dose of methylene blue was, quote, an useful addition to lithium in the long-term treatment of manic depressive psychosis, end quote. And the patients were significantly less depressed overall. Methylene blue also resists Alzheimer's disease. Alzheimer's disease and other forms of dementia are associated with the buildup of the protein called tau. Clinical trials show that methylene blue inhibits this tau formation. It is therefore under consideration, of course, as a treatment for Alzheimer's nowadays. Methylene blue has an inhibitory action on the so-called cGMP pathway and affects other molecular events that are closely related to the progression of Alzheimer's. It boosts neuron resistance to the formation of amyloid plaques and neurofibrillary tangles. It helps repair also impairments in the mitochondrial function and the cellular metabolism. And research also shows that cholinergic, serotonergic, and glutamatergic systems all play important roles in the development of Alzheimer's and other cognitive disorders. Methylene blue provides beneficial effects in mediating these pathways. And this is particularly significant because most existent treatments for Alzheimer's can only prevent the disease before it is diagnosed. But methylene blue shows promise in delaying the effects of Alzheimer's in dementia after it has already started. Methylene blue is also a very effective anti-aging nootropic. It increases mitochondrial complex 4 by 30% and enhances cellular oxygen consumption by 37 to 70%. It also increases heme synthesis and reverses premature senescence caused by H2O2 or cadmium. Methylene blue is considered a redox agent, meaning it cycles between oxidized and reduced forms, and this cycling helps block oxidants production in the brain mitochondria. The mitochondrial complex 4 is the last enzyme in the respiratory electron transport chain of the mitochondria and the last step in synthesizing ATP, and which is of course your cellular and mitochondrial source of energy. Iron, or heme, is an essential element and participates in oxygen transport, DNA synthesis, as well as electron transport. So heme synthesis begins in the mitochondria, and every cell requires heme to function properly. Senescence, or biological aging, is the gradual deterioration of cellular function and is caused by telomere shortening that triggers DNA damages in response to reactive oxygen species as well as hydrogen peroxide, cadmium, and other toxins. Methylene blue helps prevent, therefore, premature senescence or premature cell death. So how will you feel when you take methylene blue? Methylene blue as a nootropic feels different than any other supplement you've ever tried. When you're reading or you're studying, and once you're done, you will feel like you fully understand the subject matter. You will be able to use what you've learned in the future, and it seems also to facilitate a full understanding of something on the first try. Many neurohackers report the biggest nootropic effects they experience with methylene blue is that after learning something new, it sticks much better. And you take in the information, and it's like your brain sorts through the material, then stores it in a form that you can easily access. And methylene blue has also this uncanny ability to rewire your brain to forget about any negative associations you have with any situation, and only retains the positive aspects of that memory. Some report also that methylene blue makes you feel young again. It eliminates social anxiety and you feel focused and more confident. Also, workouts seem to be easier because you have more energy, your mitochondria are energized, and you find that recovery from workouts is also much easier. Methylene Blue also helps eliminate stress, so you have more energy in any situation with a relaxed state of mind. It also significantly improves sleep patterns and is particularly useful for students and executives who want to boost cognition, learning, and memory. Next, let's talk about dosage. How much of methylene blue should you take? And of course, those are just guidelines that come from clinical studies with animals as well as humans. And as you will see here, the range is quite big. It ranges between 0.5 milligrams per kilogram and 4 milligrams per kilogram. This translates, for example, for a 200-pound person to 45 to 360 milligrams of methylene blue per day. In our opinion, 45 milligrams of methylene blue per day is a safe starting dose, and 360 milligrams for a 200-pound patient is a little too high. Therefore, our recommendation would be that you start with the lowest dose of 0.5 milligrams per kilogram of body weight and see how you react first. Methylene blue is water soluble, so you don't need to take it with a meal or healthy fat like some other nootropics. It has also a half-life of about 5 hours. That means that you can dose twice a day. It's also famous for turning urine blue. And for most neurohackers, your urine will only stain blue at doses that exceed 500 milligrams per day. Some recommended recommendations for preventing this blue urine is to mix methylene blue with ascorbic acid for 3 hours before you take it. Methylene blue is also available as a doctor-administered injection for therapeutic use, typically used to treat diseases like malaria or in combination with vitamin C as a cancer therapy. And of course, because the range is so big, we recommend that you talk to your trusted health practitioner or you enroll to our health services, link in the description box below, where we will guide you through this treatment. And it is especially important that you do not perform this methylene blue treatment by yourself without any supervision, because if you overdose, it can have some detrimental effects. So let's talk about the unwanted side effects it can have when you overdose. It shows a so-called hormetic dose response with opposite effects at both low and high doses. Lower doses of methylene blue work well as a nootropic with all advantages that we've mentioned. High doses do not work as nootropic because methylene blue can potentially steal electrons away from the electron transport chain, thereby disrupting the redox balance and acting as a pro-oxidant instead of an antioxidant. It is therefore very important not to turn MB from an exceptional drug into a harmful product by overdosing. Adverse effects of methylene blue may also come from chemical impurities like arsenic, aluminum, cadmium, mercury, and lead. At low doses, these contaminants are not that big of a problem, but higher doses will result in the accumulation of these toxins in your cells, and it will become harmful thereby. Side effects with methylene blue are very rare when the doses are about 0.5 milligrams per kilogram. Side effects can include stomach pain, chest pain, dizziness, headaches, sweating, confusion, high blood pressure, shortness of breath, accelerated heartbeat, tremors, skin turning blue, urine turning blue or green, reduction of red blood cells, or jaundice, which is only reported in infants. If you are using other antidepressants or anti-anxiety medications that affect serotonin, you should also not use methylene blue, because using methylene blue with one of these medications could cause serotonin syndrome. Drugs that interact with the MB may be SSRIs and MAOIs, such as citalopram, fluoxetine, fluvoxamine, paroxetine, sertraline, zimelidine, bupropion, buspirone, clomipramine, mirtazapine, and venlafaxine. Also, do not use methylene blue if you are pregnant or breastfeeding. Methylene blue donates electrons in the electron transport chain, as we've discussed, in your mitochondria. So experienced neurohackers suggest avoiding also taking CoQ10 or IDB when you use MB, because it seems to make methylene blue much less effective. So please do not take this by yourself without any professional guidance. If you need professional guidance, enroll to our health services, link in the description box below, or contact us. Contact information is also in the description box below, or talk to your trusted health practitioner. Let's sum it all up and come to some conclusions about methylene blue then. It's an extraordinary and very potent remedy, as you've seen, for the therapy of neurodegenerative diseases such as Alzheimer's and Parkinson's, but also it's great for improving aging conditions and ailments related to aging. It's great as a memory booster, it's a great antioxidant, and even works great for cancer therapy. MB's intrinsic properties in low dosages make MB one of the best neurotransmitters, neuroprotective agents, antioxidants, and anti-aging agents. It improves memory, it increases brain cell respiration, improves significantly the brain cell oxygen usage and glucose metabolism, and by increasing the ATP production in the brain's mitochondria cells, the MB provides more cellular energy for better overall brain function, including cognition, mood, and memory. It can also rescue the brain cells' mitochondria from the damaging effects of toxins, as we've seen, which are responsible for Parkinson's and Alzheimer's disease. Methylene blue also counters cerebral ischemia, reperfusion damages, which can occur with traumatic brain injury and strokes. It's the best antioxidant. It binds to superoxide, as we've learned, and reduces it to water, and thereby it stops the oxidative cascade at its very beginning. It's also a booster for the so-called acetylcholine, resulting in better cognition functions of the brain, more focus, alertness, better learning, and improved memory. It's also a very, very potent antidepressant. It helps with manic depressive psychosis, bipolar disorders, and it does this by inhibiting the so-called monoamine oxidase, as we've learned. Methylene blue is also a very effective anti-aging nootropic. It increases mitochondrial complex 4 by 30%. It enhances cellular oxygen consumption by 37 to 70%. It also increases heme synthesis and reverses premature senescence caused by H2O2 or cadmium. And the last step in synthesizing ATP is the mitochondrial complex 4, which is your cellular and mitochondrial source of energy. And MB helps prevent premature senescence and premature cell death. It also furnishes enough heme to the cells, and thereby it helps avoid cellular mutation. Therefore, in low dosages of 0.5 to maximum 4 milligrams per kilo of body weight, and methylene blue solution of 1 to 3% can work wonders. And we offer here a unique product that combines super purified pharmaceutical grade MB that is mixed with pharmaceutical grade DMSO, and will show you all of these health benefits that we've talked about. Link is going to be, of course, in the description box below. If you have any questions or you need personal advice, again, please do not hesitate to contact us. shop@lyranara.com. Complete contact information in the description box below also for you. Also, do not forget to enroll to our health services for the diagnosis and a personalized treatment plan that you deserve and need. If you've enjoyed this presentation, as always, please support our work by liking, sharing, and subscribing. Spread the word. And until next time, stay healthy.